Hypovolemic shock is due to loss of blood, for example, massive hemorrhage or plasma volume, for example, vomiting, diarrhea, severe burns, burn shock. Then silent features are when it is due to excessive bleeding, it is known as hemorrhagic, traumatic or wound shock. It is the most common cause of hypovolemic shock in forensic practice. Bleeding, diastasis, victims with hemophilia or other bleeding diathesis may succumb to relatively minor injuries. Quantity of blood loss may be approximately judged by observing scene of death, amount of blood lying around the victim. Then classification, it would be classified according to the etiology, source of bleeding, destination of bleeding, time period of bleeding, quantity of blood loss. Important points of each are as below. Number one, etiology. First, A, traumatic due to wounds involving blood vessels or severe laceration of viscera. Then B, spontaneous bleeding, diathesis, etc. Source of bleeding, number one, cardiac, arterial, venous, capillary. Then 3, number, destination of bleeding, whether it is external, outside the body, internal, within the body. Apoplexy in an older term, use it for cerebral hemorrhage. For petechiae, ecchymosis and hematoma, please see as in chapter this asphyxial and all. Time period of bleeding, primary hemorrhage occurs immediately after injury, secondary hemorrhage delayed for several hours up to 24 hours after injury due to increase in BP which accompanies recovery from shock, muscular movements which loosen, blood clots and erosion of sloughing of vessels walls due to infection. Primary and secondary head injuries and intracranial hemorrhage. Then number 5, quantity of blood loss. Sudden loss of blood is more dangerous than the same quantity of loss occurring slowly. Classification, sudden loss is divided into 4 classes by the American College of Surgeons Advanced Trauma Life Support, that is ATLS. Class 1 hemorrhage involves loss up to 15% of blood volume. There is typically no change in the vital signs and fluid resuscitation is not usually necessary. Then class 2 hemorrhage involves 15 to 30% of blood volume sign, tachycardia and narrowing of difference between the systolic and diastolic blood pressure, peripheral vasoconstriction, skin pale, cool to touch, changes in behavior, volume, resuscitation with crystalloids, typically required blood transfusion is not usually necessary. Then class 3 hemorrhage involves loss of 30 to 40% of circulating blood volume, signs, decreased BP, blood pressure, the increased heart rate, peripheral hypoperfusion, shock, mental status worsens, fluid resuscitation with crystalloid and blood transfusion is necessary in class 3. Then class 4 hemorrhage involves loss of more than 40% of circulating blood volume. Measuring blood loss, that is clot of fist size, contains 400 to 500 ml. Then fourth, death occurs with aggressive resuscitation is not initiated. Postmortem bleeding, blood remains in a fluid state for some time after death.
If you injured during the period,
injured during a period, bleeding may occur postmortem and may give it rise to suspicion that the wound was produced before death. Differentiation is done by looking for vital signs around injury site and histopathology.
Thank you.
Thank you.